They have labeled me with treatment-resistant clinical depression and insomnia. I had dealt with it for 30 years by then. I have done 30 years of therapy, many different medications, and anything that Western medicine had to offer me. And I was only getting worse. So at that point, my psychiatrist basically said, I don't have anything else to offer you. And I couldn't even drive home because I couldn't digest that statement. It's like, what does that mean? You don't.
Have you ever wondered if the emotional experiences that you had decades ago could be shaping your health today? What if anxiety, chronic inflammation, autoimmune disease, even cancer risks weren't simply random events, but clues pointing towards unresolved patterns stored deep within your nervous system? Today's conversation may completely change the way you think about health. I'm your host, Dr. Mary, and for more than 30 years, I've integrated chiropractic care with energy medicine, helping people to reconnect with their body's innate healing intelligence. My intention with this podcast is simple to bring you practical tools, inspiring conversations that can empower you to become an active participant in your own healing journey. Today, I'm honored to welcome Dr. Noushin Hart, a board certified radiation oncologist who has spent decades caring for cancer patients while expanding her work to include trauma informed healing, nervous system regulation, energy medicine, and prevention. Her unique approach bridges the best of conventional medicine with neuroscience, subconscious healing, and energetic coherence in lifestyle medicine, offering you hope and practical strategies for anyone seeking greater vitality and long term wellness. Let's dive in. Dr. Machine, welcome to the podcast Energy Medicine. I have to say, as I was preparing for our conversation today, you are one of the most fascinating people that I have the honor and the privilege to interview here on the podcast Energy Medicine. You are a physician. You are a radiation oncologist. You deal with people who are up against the challenge of facing cancer. And so I have to know from you, from your own personal experience, what was the pivotal moment that you realized that conventional medicine was no longer telling the whole story about health and healing?
Thanks for having me. And I remember that pivotal moment like it was yesterday, sitting in front of my own psychiatrist, telling me he has nothing else to offer me. And thankfully, it was rare that I have told that to my own patients, but to be in their shoes for the first time was a shockingly life-changing moment, which cracked the box of Western medicine wide open. And I dived out.
I can only imagine. I can only imagine. So, were you facing a terminal diagnosis as well?
I wouldn't call it terminal, but they have labeled me with treatment-resistant clinical depression and insomnia. I had dealt with it for 30 years by then. I have done 30 years of therapy, many different medications, and anything that Western medicine had to offer me. And I was only getting worse. So at that point, my psychiatrist basically said, I don't have anything else to offer you. And I couldn't even drive home because I couldn't digest that statement. It's like, what does that mean? You don't have anything else to offer me. And I misheard what he said. I heard that there was nothing else for me instead of hearing that he had reached the limitations of Western medicine.
Interesting. We do have selective hearing when we are operating, as a patient. I'm a big advocate and proponent of what to have a second person, that can listen during the consultation so that you have two sets of ears listening to the same information.
Right.
So you were obviously being raised and indoctrinated in the Western medical model. When was it that you said there's got to be more and it may be, just maybe beyond what the Western medicine has to offer?
I was in such a bad shape, not being able to sleep, and very, very depressed, that I knew that something else had to give because I couldn't continue like that. And since Western medicine didn't have anything else to offer, I had to come out of it. Up to that point, I was very data driven. So if anything had to, anybody, anything was like, okay, try this. I'm like, where is the data? At that point, I just threw that out of the window. It's like, I don't need data. Just tell me what to try. And I tried many, many things that did not answer, but two modalities literally saved my life. And those are the ones that I'm offering now.
Okay. So I know that you use in MAP method, MAP method, to help people resolve their own trauma without having to relive that experience. Because sometimes, the more that you talk about it or the more that you relive it, it neurologically re-ingrains those old conditioned responses. And so the physiology within the body responds the same way that it always has. And so your MAP method approaches it from a different lens. Can you share more about that?
Yes, MAP stands for Make Anything Possible. And actually, the founder is a psychologist herself who, just like me, lives in Houston. And she has recognized the shortcomings of psychotherapy.
Mm.
And I, as a patient, had experienced it because, just like you said, for 30 years, I had to repeat this re traumatizing stories of my childhood trauma, which was only making my situation worse. MAP, on the other hand, works at a subconscious level. There is absolute no need to tell stories whatsoever. 6 sessions of MAP neutralized my childhood trauma. And all I needed to do was to imagine one of my events of sexual abuse without talking about it or describing it. As the MAP coach was really communicating with my higher self, or we call it superconscious. And all the healing was done by my higher self. The MAP coach, all she or he does is communicating with my higher self, and that is done through muscle testing. Yes and no answers. And it was mind boggling for me. After 30 years of therapy, I'm like, what? 6 sessions? And I was like, knowing the link between unhealed childhood trauma and all physical illnesses, including cancer. Even as an oncologist, I felt responsible that I need to learn this method. And it took me close to a year to learn the method, but I'm glad I did because not too many people know about it. It's really painless, it's really quick, it's very private. It can be done in groups, it can be done in person, and I really, really think very highly of it.
Dr. Noushin, I can feel the collective sigh from everyone that's listening today that says, whew, I don't have to retell my story again and again and again. And then the second part that I can feel collectively is the sense of empowerment by working through the MAP protocol. So you have a practitioner who more or less acts as a facilitator, but your consciousness, your super consciousness, your higher self, you, the individual, are empowered to heal yourself.
Absolutely.
That's fabulous. Now, there's also another modality that you work closely with, and that is the Kundalini Activation Process, also known as CAP, KAP. So, can you share how this stands alone as a modality and how you blend it with the map?
Yes. So I have a very simple mind myself, and I tend to use analogies. So the way I tell how these two work together, I say, if you want to get a massage, you go to a masseur and say, I want to get a massage. And they say, is there any part of your body that you want me to work on? I say, yeah, my neck has been really bothering me. That is MAP. It's addressing a certain thing, like trauma, childhood trauma, adulthood trauma. Or you may go and say, no, I just want to get a general massage, feel better. That's CAP. CAP raises your vibrations. And as you know, and your audience knows, everything is energy, everything is frequency. So emotions have their own frequency and vibration, thoughts have their own frequency and vibration, and our states of health or disease have their own frequency and vibration. So when you raise your vibration, automatically you experience higher vibration emotions such as joy, such as gratitude. You experience higher vibration thoughts such as positive thoughts, and you become physically healthier because health has a higher vibration compared to disease.
Okay, so those I'm going to share. We're going to talk openly about this. When we talk about, in my containers, when we talk about the Kundalini energy, we're talking about that serpentine frequency that comes up and rises out of the pelvic bowl, comes around the chakra system, and then comes together in a culminating part just behind the pineal and that sacred bridge between the pineal and the pituitary gland. And oftentimes, Kundalini yoga practitioners will use breath or movement or spinal rotations or arm lifts in order to actively engage those energy centers. When you're using the CAP method, what does it look and feel like?
So in CAP, the direction of energy is the opposite.
Okay.
Because it is not something that you do. You receive transmission of energy from a facilitator like me. So the energy actually enters crown and moves towards your root chakra. And all you do is that you lie down, you close your eyes, you relax, and you listen to a playlist that I have created, minimum of 60 minutes, maximum of 90 minutes. And as you're lying down, relaxing, basically surrendering, I transmit energy to you. So the main difference between CAP and Kundalini Yoga or Kundalini breath is that CAP is an ease-based process, meaning that you do not do anything. In fact, I ask you not to do anything. But in other modalities, you're doing something, either a movement or a breath, and the direction of energy is the opposite.
Okay. Sounds very similar to, again, based upon traditional Chinese medicine with, the acupuncture meridians and the strength at the crown of the head and how life force energy enters into the cranium and down the spine, down into the pelvic bowl. And that's how we do receive the information. Just happens to be a different pathway than what we traditionally think of as Kundalini. But so am I hearing you correctly, Dr. Noushin, that if this is an audio frequency that a person listens to for 60 to 90 minutes, is this something that you can prepare? Can you prepare the frequency and deliver the energetic transmission remotely for patients? Even though you're in Houston, can somebody in San Francisco receive your session?
Absolutely. I have clients in Iran, in India, in Canada, everywhere. We live in quantum energy.
Mhm.
There is no locality. So yes, it can be done in person or online.
You know what, I always ask that. I know the answer to that question,
Yeah.
obviously, based upon what it is that I do for a living. However, I think it's important for the audience to hear that energy is not bound by time or space. And so it's just you phrase it in a different way. And so I think that's wonderful. One of the things, Dr. Noushin, that excites me is that you and I both use a modality, a diagnostic tool, if you will, in our offices called the BioWell machine. And I've talked about this in previous podcasts, but essentially, listeners, if you're new to this device, imagine sitting on a surface in front of you is a 4 by 4 white square, and on the front of the square is a little hole in which you put your finger into. And you have a computerized system that is that's connected to this box. But you put your finger in there and it touches the lens. And then there is a moment of excitation where there's an electrical stimulus that the lens provides into your biofield. And then all of the electrons in your biofield get excited and they disperse out, and when they disperse out, they create and hit air molecules and create gas. So, with this box, you can measure stress, energy, vitality. You can even see what's happening within your chakras. So, Dr. Nishin, how do you use it in your practice? And what have you seen clinically by utilizing this BioWell machine?
Initially when I started using BioWell as a Western medicine kind of mind, I had a period of transition between understanding CT scan and MRI scan, which is like very fixed images, versus BioWell, which is a very dynamic kind of image. And it was fascinating for me that a scan now versus half an hour later was completely different. So I use it sometimes before and after CAP, before and after MAP. So the client sees how a modality changes their energy system. I also use its accessories such as a Sputnik or water, just to compare different waters to show what is better, or location. And also what I love about BioWell is its predictive and preventive value, because I'm very like for preventive measures. Now, when you look at CT scan, something has been done. It's already done. You're seeing something that started many, many months back. But with BioWell, you can prevent something that can happen 6 months, 12 months from now. And that is the beauty of it, that you can tell your clients, if you do this and this and this and that, then you can prevent something down the line. And that's the beauty of it.
It is the beauty of it. And anyone, the manufacturers, the founders, whoever made the machine will say this is not a diagnostic tool. However, you and I both agree that it is predictive. It's like a functional tool. So we can take repeated consecutive images and we can see trends. We can see where there are literally weaknesses within the biofield that may be predisposing the individual for health risks if they don't already demonstrate symptoms within that area. We know that if it shows up in the energetic field, that it's only a matter of time before it penetrates into the physical body. So I find it fascinating. I love that we can kind of geek out over this. That's just a wonderful thing.
Yes.
And we can talk again about, the energetic coherence that
Mhm.
happens as well. So inevitably, there's going to be a listener that, unfortunately, in present time is dealing with cancer or some kind of a terminal illness, and this is kind of your area or zone of expertise. And oftentimes, with that kind of a diagnosis, people can feel very overwhelmed, exhausted, anxious, disconnected from their body because it feels as though sometimes your body betrays you. Like, how could you get this ill? So based upon the modalities, the MAP method, and the CAP method, what kind of takeaway tools would you suggest to that person who's in that position? What are some easy takeaways that people can implement today to reestablish that energetic coherence that you and I value?
So, first of all, I want to emphasize that I am not against the standard of care when it comes to cancer. I consider MAP and CAP complementary modalities that one can do alongside the standard treatment they are receiving. Again, I emphasize the connection between unaddressed childhood trauma, adulthood trauma, and cancer. So Western medicine is very good in addressing acute phases of diseases, but when was the last time ever your oncologist talked about your childhood and adulthood traumas when you saw them for cancer? So these are the things that I want to talk about. That after you get your surgery and radiation and chemotherapy, let's talk about your trauma. And also, let's talk about you as an energy being rather than physical. And let's look at your bio. Let's look at your energy centers. Let's look at your lifestyle. Let's look at everything. Let's look at you as a whole. The other thing that I want to add is that please be mindful of how powerful your mind is. Do not ask for things that if it gets to your mind, you can get it out. Like, I am very reluctant to give numbers to my patients, like your survival is this percent or whatever, because nobody knows. Those are just statistics. And the power of mind is so amazing that could also cut both ways. If I tell somebody you have 6 months to live, guess what? They live for 6 months. So don't get those things in your mind. Do the things that you can do, but don't believe all those things said about cancer, because you're way, way more powerful than you know and Western medicine knows. So if you put your mind to heal yourself, and I'm not trying to give anybody false hope, I'm just trying to tell you that you're way more powerful than you think you are. So do reclaim that power. Don't give your power away to Western medicine.
If you're enjoying today's conversation, I have a quick favor to ask. The easiest way you can support energy medicine is by subscribing to my YouTube channel. Simply open your YouTube channel and search Dr. Mary Sanders Energy Medicine, or visit my channel and click the subscribe button. And while you're there, just go ahead and turn on the notification button so you never miss a new interview or a guided meditation. Every subscription helps us reach more people like you who are ready to grow, heal, and transform utilizing the energy medicine. So now let's get back to the episode with Dr. Noushin. Those are some very profound words, and what a wonderful tip, if you will. That's the empowerment piece. Unfortunately, we are conditioned as a society to hand away our power to a physician, especially a specialized physician such as an oncologist. So, I am so thankful that you're talking about the power of the mind.
It's true. I mean, it's really, really true. And there are new ways of looking cancer. Now we believe that these cancer cells called sleeper cells exist in all of us. And what wakes them up is chronic inflammation. And this chronic inflammation, unfortunately, doesn't have symptoms that we know of, but there are tests that can be done that can discover it. So I think the most prevalent and the most underdiagnosed situation that can lead not only to cancer but many other diseases, including dementia and diabetes, you name it. I don't think there's any disease that the base of it is not inflammation. So if we can all collectively start addressing chronic inflammation, we can prevent many diseases. And for example, sugar causes chronic inflammation. Chronic stress causes chronic inflammation. Unaddressed childhood trauma, chronic inflammation. So I think we don't need to wait to get cancer or diabetes or dementia to address it. We can start addressing it today.
That's very proactive advice and very grounded in practical ways. We all love our sugar and it comes at us in so many different, it's so hidden in all of our food that we really do have to take the time to read the labels. But I agree with you, Dr. Noushin, that chronic inflammation is the foundation for a lot of the disorders, pain syndromes, physical, emotional, and chemical imbalances within the physical body. I think it is the greatest stressor that we can possibly put on our nervous system. So
Yes,
thank you for bringing that to our awareness.
sure.
There's
And
so much.
and we have to really, really pay attention to address chronic inflammation. We have to pay attention to anything that is entering our body. And that would be water, that would be air, that would be food, and that would be electromagnetic field, which we are all bombarded by it. Our cell phones, our computers, and all the cell towers and everything, and nobody talks about it. Nobody talks about it. When was the last time your doctor asked, okay, so how much of electromagnetic field pollution is in your house? On what kind of water are you drinking? Average physician doesn't get either like even 5 hours of training on nutrition. Nobody gets training on nutrition, and that is like, it's almost a cliche that food is your medicine, but it is.
That's disappointing to know, isn't it?
It is very much so.
Yeah. Dr. Nasheen, your wisdom goes so deep. I mean, wisdom is a shared experience without the emotional charge. And as practitioners, it's really hard not to have an emotional charge when you're that passionate about it. So, your presence here has been greatly appreciated. And listeners, I want to acknowledge you all as well. You have a choice as to how you want to spend your time. And so both Dr. Nushin and myself are incredibly blessed. We feel fortunate that you have joined us today. Listeners, I just want to invite you to remember some of the words of wisdom that Dr. Nushin shared, in that there is an element of empowerment. You do have control over your health and your well being more so than what the average physician will share with you. So that's the takeaway. Take that message and just continue to listen to your body, to trust your intuition, and remember, no matter what the conditions are, that healing is always possible. Thank you.
Absolutely.
Yeah, thank you, Dr. Nushin.
Thank you. Thanks for having me. I appreciate it.
Listeners, I'm Dr. Mary, and thank you for joining us for another episode of the podcast Energy Medicine.